Hey, listener, remember ECR 2024? Feels like ages ago, doesn't it?
Mm.
Well, we're about to take a trip down memory lane, a deep dive into some of the highlights.
Yeah, a little refresher course just in time for this year's Congress. Whether you were in Vienna last year or not, we're going to dig through the entire program
From the opening ceremony.
to those session descriptions you might have forgotten about.
Okay, so rewind back to Vienna ECR 2024. The theme was Next Generation Radiology, which really captured the whole vibe.
It did, yeah. Every session was buzzing with data-driven, AI-augmented, globally connected medical imaging.
Yeah, it was everywhere. And what's interesting is how that theme is even more relevant now, a year later.
Absolutely. Remember President Catalano's welcome address?
Yeah.
He emphasized that radiologists aren't just interpreting images anymore. We're at the forefront of precision medicine.
There was a lot of talk about the opening ceremony being completely different, almost shocking. Did it live up to the hype?
Well, let's just say it wasn't your typical opening ceremony. They definitely pushed the boundaries. Got people talking, which is what you want, right?
For sure. But beyond the buzzwords and the spectacle, ECR 2024 really put a spotlight on practical innovation. Remember that Innovation in Focus program?
Oh, yeah.
I was blown away by some of the topics they covered.
Sustainability in radiology, data management strategies, chatbots in healthcare. It was like a sneak peek into the future.
It felt like it. And then there were all the sessions themselves. So many deep dives into very specific areas of radiology.
Oh, yeah.
One that I remember circling in the program was the EIA Advanced course on hybrid imaging in oncology.
Oh, yeah, that was a popular one.
It was split into two parts, and they really promised to take attendees beyond FDG.
They delved into the use of hybrid imaging in managing hematological malignancies, head and neck tumors, and lung cancer. That session really underscored how hybrid imaging is becoming indispensable in oncology.
Absolutely. And what I found interesting was that they went beyond the standard FDG and talked about the newer radio tracers that are emerging.
Yeah, there were quite a few, but the ones that are really starting to gain traction in clinical practice are.
Okay, and another session that I circled in the program was the commemorative session on clinical trials in radiology, a decade of impact.
10 years of dedicated clinical trials, that's a big milestone.
It is. What I found valuable about that session wasn't just hearing about the results of the specific trials,
Right.
but getting a behind-the-scenes look at the process.
Yes.
Experts shared their experiences in planning, conducting, and publishing trials. Incredibly useful for anyone involved in radiology research.
Oh, absolutely. Especially for those who are just starting out.
Did they highlight any specific trials that had a major impact on the field?
They did. They spent some time discussing the DENSI and discharge trials. Both of those have really shaped clinical practice.
Okay, here's one that sounded super futuristic. Roundtable session. MRI-based synthetic CT.
Oh, that was a lively discussion.
The title alone had me intrigued.
Yeah. They explored the world of generating CT-like images from MRI data.
You can imagine the potential benefits.
Right. Getting detailed anatomical information without radiation exposure, that's a game changer.
Right. But I imagine there are challenges too.
Exactly. That's what the roundtable was all about. Debating the pros and cons, the practical applications, the limitations.
It was a great example of how ECR isn't just about presenting new technologies, but critically analyzing them.
Absolutely. In real-world settings.
And let's not forget about the radiographers. ECR 2024 had an entire track of sessions dedicated to the vital role they play.
It did.
I remember being impressed by how many topics they covered.
Everything from justification of radiographic examinations to optimizing practice in interventional radiology.
Yeah, it's pretty comprehensive.
Even one on developing image perception skills.
One session that stood out to me was EU4 Samira, a European Commission initiative to strengthen quality and safety in imaging. Sounds ambitious.
It is. The Samira initiative is all about improving quality and safety in medical imaging across Europe. They provided updates on the EU REST study, which looked at workforce and staffing issues in radiology. A very timely topic, considering the ongoing shortages.
Very true. Anything else from that session that's worth revisiting?
Well, they also gave an update on Marlin, which is all about radiation incident reporting. The idea is that by collecting and analyzing data on incidents, we can learn from mistakes and prevent them from happening again.
That makes a lot of sense.
Yeah.
We're all human, errors happen. But having a system like Marlin can help create a safer environment for patients and staff.
Exactly.
What else did they cover?
They talked about the BSS equipment study, which focuses on patient exposure monitoring. Essentially, it's about ensuring patients receive the lowest possible radiation dose while still getting the diagnostic information they need.
Right, finding that balance.
Exactly.
I remember them touching on Simple Rad, which deals with the therapeutic use of radiopharmaceuticals. They talked about the legal aspects, the quality and safety issues, and the importance of accurate dosimetry.
Yes. A lot to pack into one session, but it highlighted how interconnected all these different aspects of radiology are.
Okay, let's talk about a section that focused on a very specific area: alternative approaches to breast biopsy, specifically MRI-guided breast biopsy.
RC502, Alternative Ways to MRI-Guided Breast Biopsy. It was all about finding less invasive and more patient-friendly ways to perform biopsies. One approach they highlighted was targeted conventional breast imaging using ultrasound to locate lesions initially detected on MRI.
So using ultrasound instead of MRI guidance for the biopsy itself.
Exactly. Could potentially be less intimidating for patients.
Less intimidating, yeah.
And the experts discussed the techniques for accurately targeting the lesion using ultrasound, even when the patient's position changes from supine to prone.
I see. Not always straightforward.
No, but they shared some valuable tips and tricks.
Any other alternative approaches that stood out?
They also talked about volume navigation-guided biopsy. This technique uses 3D imaging data to guide the biopsy needle to the precise location of the lesion, like having a GPS for your biopsy needle.
Wow, that does sound pretty futuristic.
It is, and it's a minimally invasive approach that can improve accuracy and reduce complications. Finally, they touched on contrast-enhanced mammography guidance. This is a newer technique that uses contrast agents to highlight the lesion on mammography images.
So instead of using MRI to guide the biopsy, they use contrast-enhanced mammography. That's fascinating. It's amazing how technology is constantly changing the way we approach these procedures, making them less invasive and more patient-friendly.
It really is, and that was a recurring theme throughout ECR 2024. The focus wasn't just on innovation for its own sake, but on how these innovations can translate into better patient care.
Speaking of innovation, multiparametric ultrasound, or MPUS, was another hot topic in ECR 2024.
Yes, it was.
The session, ESSS, multiparametric ultrasound, MPUS, in small parts examinations. Where are we standing? It explored the latest advancements in MPUS and its applications in examining various small organs.
Basically, it's a way of combining different ultrasound techniques to get a more complete picture of what's happening inside the body.
Could you give me an example? I'm trying to visualize how that works.
Sure. Imagine you're examining a thyroid nodule. With traditional ultrasound, you're just looking at a grayscale image. But with MPUS, you can combine that grayscale image with other techniques, like color Doppler to assess blood flow, elastography to measure the stiffness of the nodule, and even contrast-enhanced ultrasound to see how the nodule responds to contrast agents.
So you're getting multiple layers of information from a single ultrasound exam. That's pretty incredible.
It is, and that extra information can be incredibly valuable in diagnosing and monitoring various conditions. They talked about its use in thyroid, breast, and testicular examinations.
Showing examples of how MPUS can help differentiate between benign and malignant lesions,
Exactly.
guide biopsies, even monitor treatment response.
It sounds like MPUS has the potential to revolutionize the way we use ultrasound.
I was excited about this back at ECR 2024.
Absolutely. And they even discussed the future of MPUS, including the role of artificial intelligence in analyzing the complex data it generates, which, as we all know, is where things are heading in just about every area of radiology these days.
Okay, before we wrap up this first part of our deep dive into ECR 2024, I want to touch on a session that focused on a more, well, let's call it a classic topic in radiology.
Right.
Aortic aneurysm and dissection,
Right.
RC515 ornist, aortic aneurysm and dissection,
Right.
classification, imaging, and management.
Might sound like old news, but it's always relevant.
It is. They started with the basics.
Anatomy, classification, pathophysiology, and clinical assessment,
A solid foundation is essential.
especially for those who are earlier in their careers.
What about the imaging aspects? Did they cover the different modalities used for diagnosis and management?
They did. They discussed CT, MRI, and ultrasound.
Going into detail about the pros and cons of each modality,
The technical aspects of performing the scans.
and of course what to look for when interpreting the images.
Most importantly, yes.
And they talk about interventional radiology techniques for treating these conditions,
Absolutely. Covered various endovascular treatment options.
including the challenges and risks.
And they emphasized the importance of post-interventional follow-up imaging to monitor patients after treatment.
Okay, one more session before we take a break. This one really resonated with me because it focused on the crucial role radiographers play in shaping the future of radiology. RC614, redeveloping the role of the radiographer in clinical audit, really caught my attention,
That was a good one. Empowering radiographers to take a leading role in clinical audits.
which are essential for improving quality of care.
They discuss best practices for radiographer-led audits, how to develop effective audit programs, and the importance of clinical governance in radiology departments.
It's fascinating to see how the role of radiographers is evolving beyond just performing scans.
It is.
They're actively participating in shaping the future of the profession, taking ownership of quality improvement initiatives, really becoming integral members of the radiology team.
I couldn't agree more. And it's not just about audits. Another session that highlighted this evolution was of 3R, maximizing the potential of CT technologies for enhanced patient safety.
What were some of the key topics they covered in that one?
Well, they dove into the latest advancements in CT technology, particularly photon counting CT,
And how those advancements can be used to improve patient safety.
especially when it comes to radiation dose optimization.
They emphasized the need for radiographers to have the skills and competencies to effectively utilize these advanced technologies.
It's not just about having the technology.
It's about having the trained personnel to use it safely and effectively.
Exactly.
They also talked about specific strategies for optimizing radiation dose in cardiac CT and pediatric CT.
Areas where dose reduction is particularly critical.
That's great.
Hmm.
It shows how ECR is not just focused on the high-tech aspects of radiology,
Uh,
but also on the fundamental principles of patient care and safety.
exactly. Did you catch the session on CEUS in abdominal and GI radiology? RC301 CEUS applications in abdominal and GI radiology, let the bubbles burst.
I did. Sounds like it was a very hands-on practical session. What did they cover?
They delved into the practical applications of CEUS in imaging various organs,
Like the small bowel.
the liver and other abdominal organs,
They discussed the specific techniques for performing CEUS exams,
how to interpret the images.
how to use CEUS to guide interventional procedures and monitor treatment response.
It was a valuable session for anyone working in abdominal and GI radiology.
I'm trying to recall if there were any other sessions that focused on specific areas of the body.
A 4R, a holistic approach to osteoporosis, emphasized the importance of early detection and prevention of osteoporosis.
Crucial. What did they highlight in that session?
They focused on how radiographers can play a key role in identifying patients at risk for osteoporosis, performing accurate DEXA scans, and even providing patient education on bone health.
Going beyond just taking the images.
To actively participating in patient care and management.
It really ties back to that recurring theme we've been talking about. The expanding role of radiographers in the future of radiology.
It does.
It's inspiring to see how they're stepping up to the challenge and embracing these new responsibilities. But this is just a taste of what ECR 2024 had to offer.
You're absolutely right. We've only scratched the surface.
And that's why we're splitting this deep dive into multiple parts. We want to make sure we cover all the most interesting and relevant sessions from last year's Congress. Stay tuned, listener, because in the next part, we'll delve into even more fascinating sessions that will get you thinking, get you excited, and get you ready for ECR 2025.
Welcome back to our deep dive into ECR 2024. Last time we left off talking about the expanding role of radiographers. But let's switch gears now and look at some of those cutting-edge therapies that were generating buzz last year.
Yeah.
One that comes to mind is RC406 imaging-guided theranostics, current clinical practice, and recent developments.
Theranostics was huge, combining therapy and diagnostics into one targeted approach. It felt like everyone was talking about it.
It did, yeah. This session got into the specifics, focusing on prostate cancer and neuroendocrine tumors, both areas where we saw some major advancements in 2024.
Yeah. For prostate cancer, I remember them talking about PSMA-based theranostics.
Yes.
I'm a little fuzzy on the details, though.
Yes.
Can you remind me what PSMA is and why it's such a promising target?
Sure. PSMA stands for prostate-specific membrane antigen. It's a protein that's often overexpressed in prostate cancer cells. The beauty of PSMA-based theranostics is you can use this target to deliver therapies directly to the cancer cells, minimizing damage to healthy tissue, precision medicine at its best.
Right, and they discussed the different types of PSMA-based radiopharmaceuticals that are being used, both for diagnosis and treatment. It's incredible how these targeted therapies are changing the landscape of cancer care.
They are.
What about neuroendocrine tumors? What kind of theranostic approaches were they excited about?
They focused on somatostatin receptor-based theranostics. Neuroendocrine tumors often overexpress somatostatin receptors, making them a good target for this type of therapy. The idea is similar to PSMA-based theranostics. You're targeting a specific receptor that's overexpressed in the tumor cells, allowing for more precise delivery of treatment.
So the principle is the same, just a different target for a different type of cancer.
It's amazing how rapidly this field is evolving.
It is.
Did they talk about any new developments or challenges in imaging-guided theranostics?
Yeah, they discussed some of the latest research on new radiopharmaceuticals and imaging techniques, as well as the ongoing efforts to personalize therapies based on each patient. There's still a lot of work to be done, but it's clear that imaging-guided theranostics has huge potential.
Absolutely. Let's switch gears again and talk about a session that's essential for any radiologist who deals with cardiac imaging.
Okay.
EI 418 coronary heart disease. Radiology is key.
The title says it all. It does. This session covered a lot of topics related to coronary heart disease, from assessing stable chest pain to managing acute chest pain. They really provided a comprehensive overview of how radiology is crucial in diagnosing and managing this condition.
It did.
Thinking back to that session, I remember being struck by how much cardiac imaging has advanced. We have so many tools at our disposal now to visualize the heart
We do.
and assess its function.
You're right. They talked about all the different imaging modalities like CT angiography, cardiac MRI, myocardial perfusion imaging, and they really emphasized understanding the strengths and limitations of each modality so you can choose the right test for the right patient.
Did they discuss any specific conditions related to coronary heart disease that are particularly challenging?
They spent some time discussing MINOCA, myocardial infarction with non-obstructive coronary arteries. It's a tricky one because you're dealing with a heart attack. But the coronary arteries don't show any significant blockages on angiography. Imaging is crucial in these cases.
To rule out other causes.
And guide treatment.
And I remember them talking about coronary artery dissection.
Yes.
A tear in the wall of a coronary artery. Another condition where imaging is essential.
Absolutely. That session was a good reminder that even with all the advancements, we still need a strong foundation in cardiac anatomy and pathophysiology.
To make those accurate diagnoses and guide treatment decisions.
Absolutely.
Speaking of strong foundations, we can't forget about radiographers. ECR 2024 had a strong focus on them and the vital role they play.
Yeah.
I remember being particularly interested in of 70 next-generation diagnosis, working across radiology pathology boundaries. The idea of bridging the gap between these two specialties.
Oh, too. That session was all about collaboration and how imaging can help guide pathologists.
Yeah.
They talked about how imaging can help identify the most appropriate biopsy site, improve the accuracy of the diagnosis, and how imaging can monitor treatment response.
It makes perfect sense.
It does.
By working together, radiologists and pathologists can provide more personalized and effective care.
It's not about one specialty being better. It's about recognizing the strength of each.
And finding ways to combine them.
For the benefit of the patient.
Exactly. And it was encouraging to see ECR 2024 embrace this multidisciplinary approach. They had several sessions that focused on integrated diagnostics, where imaging biomarkers are used to create a more complete picture
Yes.
of a patient's health.
That's right.
I remember being excited about EF2 integrated diagnostics in radiology.
Yeah.
It felt like a glimpse into the future of medicine.
It did. They talked about how imaging biomarkers can provide information about a wide range of factors, from the size and shape of a tumor to the blood flow in a specific organ.
Yeah.
And by integrating these biomarkers with other patient data, you can get a more holistic view, which can lead to better decisions.
Did they talk about any specific examples of how integrated diagnostics is changing clinical practice?
Well, they discussed how imaging biomarkers are being used to predict treatment response. This can help avoid unnecessary treatments for patients who are unlikely to benefit. They also talked about how biomarkers can guide personalized therapy tailoring treatments to individual patients.
So moving away from that one-size-fits-all approach to medicine.
Towards more individualized strategies.
That's really where the power of integrated diagnostics lies.
It is. And they even touched on the concept of digital twins, virtual representations of patients that can be used to simulate different treatment scenarios.
Digital twins. That sounds like something straight out of science fiction.
It does sound futuristic, but it's becoming a reality. The idea is that by creating a digital twin, you can test different treatment approaches in a virtual environment before actually administering them to the patient.
Wow. So you're basically running simulations
Exact.
to see how a patient might respond to different treatments.
It has the potential to revolutionize healthcare.
That's incredible.
Mm.
I'm starting to see how all these different pieces fit together. Theranostics, integrated diagnostics, digital twins. It's like we're moving towards a future where medicine is truly personalized and data-driven.
Exactly. And artificial intelligence, or AI, is going to play a huge role in making that vision a reality. AI was everywhere at ECR 2024, and for good reason. It has the potential to transform every aspect of radiology.
Speaking of AI, EI Bar 7, Artificial Intelligence, AI, for health imaging. Pioneering cancer image repositories for diagnosis and analysis really stood out to me. They talked about the importance of data in developing those AI algorithms, right?
Yes, they did. They discussed creating large-scale cancer image repositories to train and validate the AI algorithms.
Yeah.
These repositories are essential because AI algorithms need to be trained on massive amounts of data to be accurate. It's like creating a massive library of medical images that AI can learn from.
So these repositories are essentially the foundation for
Yes.
developing those AI algorithms that can improve diagnosis, prognosis, and
Right.
treatment.
They talked about several initiatives that are underway in Europe to build these repositories, including Chameleon, Ecanimage, and Incisive. Each one has a specific focus, but they all share the common goal of harnessing the power of AI to improve patient care.
It sounds complex,
Yeah.
but the potential benefits are enormous.
Yeah.
Imagine AI helping us detect cancers earlier, predict treatment response more accurately, and even develop personalized treatment plans based on a patient's genes.
It's mind-blowing.
It is, and it's just one example of how AI is poised to revolutionize the field of radiology.
It's not about replacing radiologists. It's
Mhm.
about giving us the tools
Augmenting our capabilities.
to provide even better care.
Exactly.
Okay, before we move on, I want to circle back to a more specialized topic that was covered.
Right.
Imaging of the aorta after interventional procedures.
E25B, the post-interventional aorta.
I remember this session being packed with practical information. It was a deep dive, focusing on procedures like endovascular aneurysm repair, or EVA. They talked about the different imaging modalities used to assess the aorta after these procedures, like CT and MRI, what to look for when interpreting the images.
So it's about making sure that the repair is holding up
Yes.
and that there are no new problems.
Exactly. They went into detail about the types of complications that can occur after EVAR, like endoleaks, leaks that can occur around the endograft. They also talked about the normal post-operative findings, so you can distinguish between those and potential complications. It was a very practical session
Yeah.
with lots of real-world examples.
That sounds like it. As we're talking about all these sessions, I'm struck by the sheer breadth and depth of topics that were covered. It really was a comprehensive Congress covering every aspect of radiology.
It was. It wasn't just about the cutting-edge technologies. There were sessions on the more practical aspects of daily practice, like writing reports, communicating with patients, managing a department. It was a truly multidisciplinary Congress, reflecting the collaborative nature of modern radiology.
And it wasn't just about the science and the technology.
Right.
There was a clear focus on patient-centered care. They had sessions on reducing radiation exposure, improving communication with patients, addressing health disparities. It was great to see that ECR is truly committed to putting the patient at the heart of everything we do in radiology.
Absolutely. Okay, we've covered a lot of ground, but there's still more to explore. In the next part, we'll look at some sessions that focused on specific areas of radiology, like breast imaging, musculoskeletal imaging, and neuroradiology. Stay tuned. We're about to take you on a journey through the diverse and fascinating world of next-generation radiology.
Welcome back to our final installment of this ECR 2024 retrospective. It's hard to believe we're already on part 3. Time flies when you're reliving all the exciting advancements in radiology. We've covered so much ground already, from cutting-edge therapies to the evolving role of radiographers, but there's always more to explore. In this last part, I want to focus on a few specific areas of radiology that saw some incredible innovation in 2024. Let's start with breast imaging.
Great idea. Breast imaging is constantly pushing the boundaries of early detection and diagnosis. ECR 2024 had some fantastic sessions dedicated to this topic.
I remember RC716 breast imaging, back to basics. The title intrigued me. It seemed almost counterintuitive in a field that's all about cutting-edge technology. Why go back to basics?
Sometimes it's easy to get caught up in the latest and greatest and forget those fundamentals. That's why that session was so valuable. It focused on the core modalities of breast imaging: MRI, CEM, and of course the BI-RADS lexicon. They went back to basics, making sure everyone had a solid foundation.
BRAS is the standardized reporting system that helps ensure consistency and accuracy in breast imaging, right? I remember relying on it heavily in my early days as a radiologist.
Exactly. They talked about the importance of using BRADs correctly, communicating findings effectively, guiding clinical decision-making. It's not just about getting the diagnosis right, it's about conveying that information to the referring physicians, so patients receive the best possible care.
Okay, shifting gears a bit, another session that caught my eye was EIBall 7 lung cancer screening, implementing quantitative imaging biomarker protocols. Lung cancer screening is becoming increasingly important, especially with low-dose CT.
It is. And this session was all about quantitative imaging biomarkers, improving the accuracy and efficiency of lung cancer screening programs. Instead of just looking at images, they're using quantitative measurements, taking a more data-driven approach.
And that makes sense, right? If you can quantify the risk, you can be more selective about who gets further testing, potentially avoid unnecessary biopsies. Did they talk about any specific biomarkers that are being used?
They highlighted the QIBA profile on small lung nodule volume assessment and monitoring, provides standardized methods for measuring the volume of lung nodules, tracking their growth. It's a way to make sure everyone's measuring things the same way, improving consistency and reliability.
So by using those standardized measurements, radiologists can more accurately assess whether a nodule is suspicious, needs further investigation. Sounds like a promising area of development.
It is, and it has the potential to save lives. Detecting cancers earlier, improving the chances of successful treatment. Early detection is key.
Okay, moving on to another area where radiology is making a huge impact. Musculoskeletal imaging. Remember that session, RW10, How to Improve MSK Reports? I have to admit, report writing isn't always the most exciting topic, but this one really got me thinking.
I agree. Report writing is often overlooked, but it's such a crucial part of our job. It's how we communicate our findings, ultimately how we impact patient care. This session provided some really practical tips for improving MSK reports, which I think benefits everyone.
Absolutely. They talked about the importance of using standardized terminology, avoiding jargon, and really focusing on the key findings. Be clear, concise, and get to the point.
They did, and they even shared real-world examples, both good and bad. Made it easier to see what works. Sometimes it's easier to learn from examples, wouldn't you say?
For sure, everyone walked away with some valuable insights. Apply them to their own reports.
It's all about communicating more effectively with our referring physicians and ultimately provide the best possible care for our patients.
Okay, let's talk about neuroradiology. This is one of my favorite areas, and there were some amazing sessions exploring advancements in brain and spine imaging.
Absolutely. One that stood out was E1119 CT, a multiparametric technique. This session was all about how CT scanning is becoming more sophisticated, moving beyond just anatomical imaging to provide functional and even molecular information.
I remember hearing a lot of buzz about multiparametric CT last year. It sounds incredibly advanced. Can you break it down for me? What were some of the specific techniques?
Spectral CT, photon counting CT. Spectral CT uses different energy levels of X-rays, create images that differentiate between different tissue types, even identify specific substances, calcium, iodine. It's like getting multiple layers of information from a single scan.
So instead of just seeing a grayscale image, you can actually see different colors. That's fascinating. And what about photon counting CT? How's that different?
Photon counting CT takes things a step further. Actually counting individual photons of X-rays that pass through the body allows for more detailed and precise imaging, potentially with lower radiation doses.
Wow. That's incredible. It really sounds like these advancements are going to revolutionize the way we use CT. What are some of the potential applications?
They talked about a wide range of applications, from characterizing tumors and assessing stroke damage to evaluating coronary artery disease and detecting subtle bone fractures. The potential is enormous.
It sounds like it. Okay, what other neuroradiology sessions stood out to you?
RC 1403 imaging of microvascular dysfunction was a fascinating one, highlighted the importance of imaging those tiny blood vessels. They can play a role in a wide range of conditions, from heart disease to stroke to dementia.
That's right. We often focus on the larger vessels, but those tiny capillaries are really where the action is.
Okay.
If those tiny vessels aren't functioning properly, it can have a major impact on overall health.
Exactly. And this session discussed the different techniques that can be used. DTCT, SABECT, MRI. They also talked about the clinical implications of these findings, how they can guide treatment.
It sounds like a really cutting-edge area of research, with the potential to change the way we approach many diseases. I'm excited to see what the future holds.
I am too. It's a great example of how radiology is constantly pushing those boundaries, leading to earlier diagnosis, more targeted therapies, and ultimately better outcomes for patients.
As we're talking about all these incredible advancements, it's clear that none of this would be possible without a dedicated and highly skilled workforce. ECR 2024 did a great job of recognizing the importance of education and training.
You're absolutely right. There were so many sessions dedicated to professional development, basic science courses, hands-on workshops. They really covered everything.
One session that I remember thinking was really interesting was EDR 9, the role of artificial intelligence, AI, in exam marking. It's not something we typically think about, but it's really important.
It is. Traditionally, evaluating those free text answers has been time-consuming, labor-intensive, and it's prone to human error, which is something we always want to minimize. This session explored how AI could streamline the process, make it more objective.
Using AI to analyze those free text answers and grade exams more efficiently and accurately.
Exactly. They talked about natural language processing, NLP, to analyze those answers, provide more consistent and objective scores. It's not about replacing human judgment. It's about using AI to augment our capabilities, make the process more efficient and fair.
And that makes a lot of sense, especially as the volume of exams continues to grow. Could free up radiologists to focus on other things? Teaching and research.
Absolutely. It's another great example of how AI is finding its way into all aspects of radiology, even the ones we might not have thought of before.
As we wrap up this incredible journey through ECR 2024, I'm feeling both overwhelmed and inspired. It's amazing to see how far radiology has come, and it's even more exciting to think about the future.
Next generation radiology is more than just a catchy theme. It's a reality that's unfolding before our very eyes. From AI-powered diagnostics to personalized therapies, radiology is truly at the forefront of transforming healthcare.
And ECR is playing a vital role in driving that transformation, bringing together the brightest minds, sharing knowledge, collaborating, pushing the boundaries. It's an event that reminds us why we chose this field, inspires us to keep learning and growing.
Well said. So listener, as you get ready for ECR 2025, remember all the advancements and discussions we've talked about today. Embrace innovation, collaboration, and patient-centered care. Be a part of shaping the future of this amazing field.
Thanks for joining us on this deep dive back to ECR 2024. We hope you found it insightful and inspiring. We'll see you next time for another fascinating exploration of the world of radiology.